Probably the single most common concern that I hear from people, particularly uh, women of childbearing age, are concerns, things that they have read about on the internet or heard from someone else about whether or not it's going to affect their fertility, whether or not they can get vaccinated while they're pregnant or while they're breastfeeding. And these are legitimate concerns that any woman would have. And so, can you help clear up any confusion about those situations and getting vaccinated for COVID?
Sure. Those are absolutely valid concerns, and you're exactly right. They're the most common thing that I'm hearing right now. There may not have been as big a COVID baby boom as some people think, but there definitely are more women that are pregnant right now and are asking these types of questions. And I've also heard questions about actual fertility throughout the last few months as well in regards to the vaccine. The vaccines are not going to affect fertility. That's based on a myth that got started on the internet a few months ago when these vaccines were first brought to market or first brought to mind so that people could understand what they were. People heard the term spike protein and they started conflating this idea that spike protein was the same as another spike protein that is involved in implantation of the embryo into the wall of the endometrium in the uterus. And that is completely false. Those two proteins have absolutely nothing to do with each other, and the structures are wildly different. There is no problem with fertility that we can point to from the millions of doses of these vaccines that have been given, and the allegation that it has that kind of problem came from a misunderstanding of the science involved. So that's part one. Part two, the American College of Obstetrics and Gynecology has put out guidelines for vaccination of pregnant women and breastfeeding mothers. The problem right now is when we talk about the downside of the vaccine versus the downside of getting COVID, there is no comparison. If you get COVID, the chances of you having significantly bad outcomes are infinitely higher than the chances of having significantly bad outcomes with the vaccine. And so because of that, the risk and the benefits of giving vaccines to any group, the benefits far outweigh the risks as far as we understand them. And we're still working to study those further. But over the last several months, there have been women that have gotten pregnant after getting the vaccine or while actively between doses of the vaccine. And fetal development in those women has been monitored very closely and has been going well. We also have data on, there's actually a large data bank that's being collected right now from breastfeeding mothers. They are contributing milk to a scientific study that is looking at antibody production and antibody exchange through breast milk that may be actually providing some protective antibodies for babies, newborns especially, that are coming from mother's milk. And that happens with other vaccines. That's why women now get vaccinated against whooping cough in that 36-week window during pregnancy, because they will pass on those protective antibodies short term while the baby's immune system is kind of revving up and literally developing. So we have some good data to show that pregnant women and breastfeeding mothers both have significant benefits, as can their children, when it comes to getting the vaccine. So we encourage, and American College of Obstetrics and Gynecology encourages every woman that doesn't have any other predisposing factors or things that would make them not a candidate for the vaccine to get those vaccines.
It's just such important information, and I hope that helps bring some clarity for women and their families on the question of whether or not to get vaccinated. And just the information that you have provided just reinforces that message about when in doubt, go visit your doctor, call your doctor or healthcare provider, and ask those questions, because I think every healthcare provider is able to help you understand what you have been hearing or reading and how to interpret that information so that you can make the best decision possible.
Absolutely. Ask a trusted healthcare professional, and ask again if you have lingering concerns or questions. Ask multiple people that you trust. Make sure you're looking for good sources. Understand that the the big governing bodies for physicians. So the American College of Obstetrics and Gynecology, the American College of Physicians, the American Academy of Family Physicians, they all put out guidelines. They all try to make sure that the most recent science and the most stable and concrete science is being used to guide the physicians that are seeing patients in the community. And so checking those places for good quality information, as well as places like the health department and the CDC.
Well, and everyone you named, their whole goal is to help support you in being healthy. And that's their whole agenda. So I think it is so important. All the entities that you listed off, great resources for people who are trying to understand what they're hearing and reading.
Absolutely.